We are live, Chair.
Good morning, everybody. Welcome to Power's Health and Care Scrutiny session today. We've got a number of items on the agenda, and just before we start going through those, I will just ask if we've got any apologies for today, please.
Yes, we have apologies from Councillor Alwyn Evans, and we have apologies from Officer Nina Davis.
Thank you. Anyone got any declarations of interest to note? Any party whips? No, but that was quick. We're straight on to the JICPA update. So if I could, oh, sorry, Chris, I can see your hands up.
Yeah, just to let you know, Chair, I do need to leave at 11 because of another appointment. So
That's absolutely
just
fine.
to let on there.
Thanks for
but
letting
I'll just
me know.
disappear. Thank you.
Thank you. Thank you. Right, we're straight on to one of our main agenda items, which is the JICPA update. Welcome to Scrutiny, Councillor Sandra, Sharon and Holly as well. I'm going to hand over to you, Councillor Sandra, if you'd like to introduce the update and the background to this item, please.
Welcome out. Bwyd da pawb, thank you very much, and good morning all. Yes, we have the papers in front of us, and it is the JICPA update for scrutiny. And the background of the paper is that in October 2023, Powers agencies were informed that Care Inspectorate Wales, CIW, Her Majesty's Inspectorate of Constabulary and Fire and Rescue Service, HMICFRS. I'm sorry that the titles are so long. Healthcare Inspectorate Wales, HIW, and Estyn would be undertaking a joint inspectorate review of child protection arrangements, the JICPA, in Powys County Council during the week commencing the 16th of October 2023. The primary focus of the JICPA involved reviewing the response to allegations of abuse and neglect at the point of identification, the quality of impact and assessment, planning and decision-making in response to notifications and referrals, the protection of children aged 11 and under at risk of abuse and neglect, the leadership and management of this work, the effectiveness of the multi-agency safeguarding partner arrangements in relation to this work. And the methodology focused on three main areas. I'll just outline the three main areas and then I will pass it over to Holly Gordon, who is waiting, I'm sure. So the three main areas were an evaluation of the multi-agency front door for child protection when children at risk of harm first became known to local services, a deep dive evaluation and experience of children at risk, an evaluation of the quality of leadership, management and governance arrangements in place to develop and support service delivery. Now, Chair, with your permission, I'll hand you over to Dr. Holly Gordon, Senior Manager of Safeguarding and Quality Assurance.
That's
Morning,
great.
Holly.
Thanks, Councillor Sandra. Holly, welcome to Scrutiny.
Thank you, Chair. Welcome. Thank you. So I'll just continue with some of the overview in the report presented today. So as you can see from 2.4 onwards, a total of 6 in-depth case file audits occurred, which focused on the practice within the previous 6 months. And 2 of those cases were then selected by the inspectorates for involved agencies to attend a focus group with the inspectors. Also, a total of 10 referrals were sampled with an emphasis on considering information, advice and assistance received. And this also included an evaluation of our front door and how we work with our multi-agency partners. It also focused on how well organisations communicate, share information and contribute to safeguarding arrangements. So in preparation for the inspection, a joint evaluation form had to be completed on 6 of the cases selected. So this was completed via a multi-agency reflective session, which drew out responses and reflections. And then on the first day of the inspection, a multi-agency presentation was delivered and led by the Directors of Social Services and Education. The inspection concluded that safeguarding organisations in Powys have systems and arrangements in place for effective joint working. Senior leaders were seen to demonstrate a joint approach to regional safeguarding arrangements, and leaders and managers were noted to have established a positive culture of joint working. There were several areas of good practice identified. So PTHB regularly attending our strategy discussions was recognised as good practice, as well as having a clear child protection medical pathway. Pupils were reported to be feeling happy, safe and listened to, and local authority leaders were seen to be scrutinising performance data and to have effective quality assurance mechanisms in place. It was noted that children's services have skilled social care workforce. Also, our wellbeing worker positions were noted to have made a positive impact, and our assessments were highlighted as comprehensive. Senior managers were also described as visible and supportive, and the in-house psychologist was recognised as providing high quality support to staff, as well as supervision being found to be frequent and our induction processes to be of good quality. Many of the identified areas for improvement were already being given attention, and additionally, some of the areas identified also reflect national areas of improvement, such as children attending child protection conferences, multi-agency auditing and training. So the JICPA highlighted that we need to give more consideration of how we support children where there are concerns of long-term neglect. So in response to this, multi-agency practice guidance and assessment tools were launched in April this year. And this provides our staff with a model to use to monitor home conditions and to support improvements. So the guidance has been adopted by agencies in children's and adult services, education, health, housing and police. The tool assesses 20 aspects of home conditions, and also it includes resources to support practitioners to capture the daily lived experience of children at various stages of development. So the toolkit was launched under our multi-agency safeguarding fora, and it was a very successful event with 80 staff attending from various agencies. Also this year, we've undertook a thematic audit for child protection visits. That was undertook between June and August of this year, and a report was completed and shared in September. The audit did find that visits were often occurring at the same time and day, even when they were unannounced. So we are sharing the audit findings in a webinar, which is actually planned for this afternoon. And this will also be supported through our theme of the season. So we're going to be doing some additional work, sharing the key messages with our staff. Outcome strategy meetings were also identified as needing to improve. We've been doing considerable work raising awareness and monitoring and tracking this, and this remains ongoing as part of our current action plan. The inspection also considered workforce stability, and as the group has already heard previously, we have seen a reduction in our social work agency reliance through our Grow Our Own programme, as well as our agency staff moving to permanent positions, and we're continuing to see increased workforce stability within the service area. The inspection also found that multi-agency audits needed to be routinely completed. This was very welcomed by the partnership. We do have a local multi-agency audit group in place, and we're currently working on a multi-agency audit with our regional safeguarding board, focusing on child protection conferences. Also, the identified need for increased multi-agency training was very welcomed. We've been currently working on developments for our joint investigation training, which is joint training with police and children's services staff, and that first course is due to commence in 2025. Further initiatives that are in development are multi-agency supervisions. Also areas the areas for improvement have been developed into a multi-agency action plan. So this is monitored and reviewed on a quarterly basis. that is shared at our LOG, our local operational group, and the action plan is also shared with our inspectorate so they can see the progress which is being made. I think the action plan continues to be reviewed, and we've made good progress since its inception. The JICPA outcome overall has been very positive for the Powers Safeguarding Partnership, and I think the public can feel assured that children are being protected and agencies are fulfilling their roles and responsibilities. Thank you, Chair.
Thank you. Sorry, I couldn't get my microphone off mute then. No, thank you ever so much for that update and very clear presentation. Just some positive feedback from me. Really good length of the report that that we like for scrutiny, got to the point, very clear. And sometimes we get reports where there's a lot too much information and we can't see the wood from the trees. So just to thank you on how that's been presented, and we really appreciate that. Anything that Sharon or Councillor Sandra you want to add before I hand over to members' questions? I know this is for us to note, but we do have a couple of questions. So Sharon, did you want to add anything? Yeah.
If that's okay. I think just for assurance to Health and Scrutiny Committee this morning, it's the JICPA, as it was called, is a really good opportunity to kind of temperature check the service in terms of practice, standards, processes, procedures, not only from the local authorities perspective, but through that multi-agency lens as well. So it was a very welcomed opportunity to kind of have the inspectorates from across a multitude of different areas, as Councillor Sandra said at the start, but looking at safeguarding through that lens, and really to kind of offer that level of assurance that that inspection process is a really, whilst it is quite a challenging process for each agency to go through, it nevertheless actually is a really good temperature check of where we're at in terms of delivering a safe service. So I just wanted to add that really. It was a very welcomed approach through the JICPA, and obviously there was a lot of positive comments made as a result of that temperature check, which was really good. But actually it doesn't just stop there. That work continues through the helpfulness of that inspection in terms of the action plan, and then considering and reflecting what we can always do differently, how we can work together, how we can kind of join up those services and those narratives. And that all feeds into the Powers Local Operational Group, which is our local group which connects to the Regional Safeguarding Board. So the Regional Safeguarding Board is Mid and West Wales. Each area has its local group. Ours is called the Powers Local Operational Group. So the action plan also gets governance through that process as well. So I just wanted to add that whilst we look at that locally, it also has that governance arrangement more regionally to kind of check on progress, actions, practice, etc. But thank you, Chair.
Thanks, Sharon. Okay, members, over to you for questioning. I know, Councillor Gareth, you had a question on resource implications of implementing improvements. Do you want to start with that one?
Yeah, thank you, Chair. Can I start with another question? Though you said about the 6 in-depth case files. I assume they were chosen by the inspectors and not by the services themselves. Just following that point that Councillor Amanda said, do we know what the cost of undertaking the audit was and what benefits we think we've gained from that for the short, medium, and long term?
Thank you, Councillor Gareth. I think quality assurance auditing has to be part of our day-to-day practice. So it's certainly a key part of my role as Senior Manager for Safeguarding and Quality Assurance. And the culture that we've embedded within Powers over the last several years is it's part and parcel of everyone's role. It's very much a whole system approach. With our, for example, our thematic audits, we deliver those quarterly. We select relevant themes, and all of our managers and principal social workers and independent reviewing officers become auditors and are required to undertake the audit to feed back to the staff whose work they've audited. and then to participate in the webinar, which shares the overall findings. So I think we've really tried to see auditing and quality assurance as part of our day-to-day practice, so we can continue to feel assured and also continue to identify the areas we require improvement.
I think Councillor Gareth is getting at the specific audit files that were selected, though. Were they, how were they selected for this? Were they ones that we identified, or was it random?
So the cases selected are always selected by the inspectorate themselves.
Okay, and then the second part of your question, Gareth, was on financial costs, really, wasn't it?
Do we know how much the audit actually cost? I know there's no cost to us, just staff time, but do we know an indication of what the cost was for agencies, and are we happy that we've had that value for money out of it in some ways?
Shall I come in on that one, Holly? I think it's about looking at it, like you said, Councillor Gareth, around through that value for money lens. So there wasn't any particular additional cost in terms of the process, but actually the value in doing it is actually the reflections in terms of the feedback from CIW and the other inspectorates through that multi-agency lens. So whilst it was quite a vigorous process in terms of all of our time who were involved in that, actually CIW did a lot of that. We provided the information, we did a lot of auditing ourselves, but also it was an opportunity for us to reflect on our journey in children's services. So you'll be aware of the previous poor inspection by CIW in 2017. So this actual opportunity with the JICPA was a really good temperature check on how far we've come from then. So I guess the value for money is looking at those reflections, that opportunity to kind of do some deeper dives to look at practice and process rather than a monetary cost, if that makes sense. I think there was a lot of value in terms of going through that process to see where we were at in terms of the progress that we'd made.
What about monetary cost, though, for implementing improvements? So, for example, you've developed this toolkit that's being used. Did you have to commission that, or is that just our resource?
Yeah, our resource again, and that's in collaboration with the regional approach. So a lot of that work comes through either from a national level or a regional level through to us locally. So there's been no additional cost in terms of the action plan. And as Holly says, what we're trying to do is create that culture of learning, that culture of an opportunity to reflect on practice. So auditing is routinely built in, as Holly described, over the year. We target key particular areas. As we had the JICPA, it made sense that we focused a lot more on those specifics, as Holly said, and then we'll continue that cycle of learning. So that doesn't really. So it was just a real opportunity for us to stop.
Yeah, can I just follow up on that and just ask, have you seen an improvement in the relationship between children's services and the other agencies, education, police, etc.? And if you have, can you just give us an example?
Thank you, Councillor Gareth. I feel that we did already have very strong existing relationships with our safeguarding partnership, but I think the JICPA has spurred us and really pushed some of the areas forward. So, for example, I mentioned in the paper the joint investigation training. That is something that Powers Children's Services have been very keen to redevelop for a number of years, and the JICPA has galvanised our partners to be on the same page as us. So we're now able to move forward with that development. So I think whilst the relationships were already positive, I think it's certainly improved, and it's motivated and galvanised further development on specifically around multi-agency training and multi-agency auditing. And I think also those two areas over the years have become more challenging. So, for example, when I was in frontline practice, multi-agency training was a much more common occurrence. However, over the years, possibly linked to how funding streams have worked, that has become more siloed, which I think has been to the detriment of practitioners. So it's really important that we continue to think of innovative ways to overcome barriers so our staff can train alongside each other and understand each other's roles and responsibilities better.
Thank you. Councillor Chris.
Thank you, Chair, and thank you, Holly, for the report. I mean, there's a lot to be pleased about in it. I mean, it's quite nice when you hear words of quality service, the strength in partnerships and the collaboration with the health board, for example, that you mentioned, the medical pathway. People feel they're being listened to, which is a nice reflection. And visible management, I think, is also one that is really positive on there. So there's a lot of nice messages in there. Again, like what Councillor Gareth had mentioned, based on previous reviews of service in this area, how was the review through the joint agency different to the previous reviews that we've had? And do you feel, so it's coming from you as being part of that service, that it is value for money on there? Because some of the things that you mentioned about self-reflection, I could have said those before with previous reviews, and my background is in health and in health visiting, so I understand some of this process. Did you learn anything new from this process? Was there any surprises? And you mentioned about an integrated training package. What's different in that to on there? Because I've heard that terminology said before, so it's a little bit, so what? So give me a little bit more. I can't get that from this report. And then looking forward, has there been any consideration of, and I'm not looking at AI in relation to child protection issues. I'm looking at it in ways to be supportive to staff, to make us more efficient going forward. And has that been considered by this review in any shape or form to see of how we can actually move things in a different way? And then briefly, I think within the report, it mentioned about sharing information protocols. And to me, when it gets done right, it's great. But when it goes wrong, communication between agencies is the bit that falls down. So what are we actually doing around that to ensure that we get it right each and every time? And then finally, what support is being put in place to those staff that are dealing with this issue on a, not a daily basis, but on a regular basis, because we have to look after them, otherwise they get burnt out. But thank you for what you've done so far.
Thanks, Chris. There's quite a lot to unpack there, Holly.
I know there was, sorry.
Thank you so much, Councillor Chris. I think that, first of all, those were really interesting questions, and I could probably reflect on that for a long time. I guess some of the initial things that come to mind, I think the inspection, the joint inspection did feel different in respect of comparing it to perhaps a siloed inspection. I think we got more from it. I think the workload and pressure in respect of there being a lot of preparation required for inspection felt similar. But I think the outcomes, and like I said earlier, the more galvanised multi-agency or sense of being in a safeguarding partnership, I think that impact has been much stronger because of that joint nature. I don't feel there were surprises. I think a lot of the challenges, like I said earlier, reflected some of the national challenges that we have in child protection practice. There has also recently been published a JICPA overview report looking at all of the 6 JICPAs, and I think there was there was a lot of similar findings, but also in 2 of those JICPAs, they specifically focused on child exploitation. And I think when you have a more narrower theme for the inspection, more perhaps rich learning comes out of that. Our theme was quite broad in respect of protecting children under 11. The joint training initiative I'm referring to is joint investigation training. So that is to support practitioners when they are required to undertake a Section 47 inquiry. Historically, that was training which was valued incredibly highly for practitioners moving through their career and getting to a more advanced point of practice. And it was always done joint. It was incredibly valuable. I can say for myself, having been qualified for 18, 19 years, it still remains the best training course I ever attended. What happened about 15 years ago, the police brought in a SkyDip course, which was a national course, and it was specifically for police to undertake the joint investigation training. And at that point, our joint training course abruptly ended across Wales. We've been in discussions with North Wales, who over the last couple of years have relaunched that joint training. That has been seen as a very positive initiative by inspectors and by the agencies involved. And I feel this inspection has really pushed up the partnership between ourselves and police to overcome the challenges of them needing to adhere to the national requirements of their qualification and understanding the value of us training jointly. So, for example, when a police officer and social worker are going out to investigate a child protection concern, there's a lot of preparation that needs to happen in terms of how they're going to engage the child, what the communication needs are, what setting is most appropriate and trauma-informed to do that. And it's such, I can't stress how valuable it is to jointly train. So I'm really pleased that we've got dates set for 2025 for that. There wasn't in the inspection, from recollection, a focus given to AI. There's certainly, they certainly consider our IT systems. That has been highlighted nationally as being quite a challenge, and also in respect of information sharing. I do feel a lot of the initiatives linked to AI in social care have really took off in the last 6 months. So I dare say if the JICPA was happening now, they would be considering how we're looking at AI. And Sharon, I don't know if you want to perhaps say a bit more about AI developments.
I think we'll possibly park that for today. Just I'm quite conscious of time because we're still on the main item. Do you want to just answer Chris's question about support for the workforce? Because I know that there were comments in there about our psychologists, weren't they? And they were positive. But if there's anything else we can add to on that. And then I think we're going to have to think about moving on, if that's okay.
Thank you, Chair. I think staff support and wellbeing is something that we've given a lot of focus on certainly since lockdown. I think Rob Painter, our in-house psychologist, has been excellent at developing systems and frameworks that enable our staff to feel more supported. So for our newly qualified staff, as you'll be aware from our Grow Our Own, those numbers have increased. So we've had an introduction of critical debrief sessions for those staff. Also, there's a development of something called a Schwartz round, where staff come together to reflect on key moments and points within their career. And also in terms of our learning events for child practice reviews, which are incredibly challenging for practitioners to come together to reflect on. Our psychologist has also supported staff in those learning event settings. We do sense check, we do have surveys, wellbeing surveys, and we do feel that our staff really recognise and value the support that's been on offer. That's also been recognised nationally. We were nominated last year as part of the Social Care Wales accolades for staff wellbeing. Thank you.
Is that okay, Chris? Yeah, great. Thank you. I just got one final question on this, which is a fairly quick question, which is to do with the unannounced visits. How are you going to monitor that going forward in terms of them taking place at more sporadic times and days, etc.?
Thank you. So one of the things that we can do to draw data is adjust the forms which practitioners write up their visit. So we now have a box which identifies whether the visit was announced or unannounced. I do need to check whether we're stipulating the time and how we monitor that. But what we have done recently is the thematic audit, and I think we need to continue periodically doing the thematic audits to map our progress. But we will be able to, from our data draws on forms, be able to pull out how many visits are announced or unannounced. Thank you.
And does that data feed into any of the performance reports, or does it need to, or does it not need to?
It's currently not part of our monthly performance data, but we do other data sense checks around plans and visits and supervision on specific cases. But also that could be considered to be part of our monthly performance report.
Okay, thank you. Thanks ever so much. Really appreciate the update and the report. And on that note, we will move on to the Integrated Disability Service agenda item. Gavin, I can see that you're here and I think you're leading on it, but Councillor Sandra, did you want to introduce this one as well?
Diolch yn fawr. I'll be very brief, Chair, because I'm aware of the time as well. I'll just outline the purpose of the report. It's to provide an update on the developments that have taken place within Children's Integrated Disability Service, IDS, over the last 12 months, and it includes the IDS early help provision. I leave it there and I pass it over to Gavin, who is our Senior Manager, Care and Support Children's Services. Thank you, Chair.
Yeah.
Thank you, Gavin.
Thanks, Sandra. Thanks, Gavin. Just to give everybody a bit of an update on time, we're almost at 20 to 11. So I think I would like to finish this item by 10 past 11, if that's okay. So we're just going to give it half an hour. I hope that's okay. But Gavin, over to you.
Thank you, Chair. Obviously, you've all received the report, which details a lot of the specifics, but I just thought it'd be useful for me just to kind of go through some of the main points of that and then open the floor to any questions, really, if that's okay.
Yeah, headlines are great, Gavin. We've all read the report. Thank you. And again, it was a good length report for us as well. So thank you for that.
Fantastic. Thank you. So the headlines are around, there's been lots of development within the Integrated Disability Service over the past year. Alongside a development plan, and kind of it was a area of the service in which we wanted to develop, and now we've got stable staffing within that as well, and resource, and actually it's been a really good opportunity for us to kind of progress in this area. So we've reviewed IDS early help processes. So the IDS early help process has been reviewed, amended, and aligned with the Children's Services generic early help team, which I think has improved paperwork and also around closure procedures, and we've also integrate a lot of resource sharing across early help cases. So that's within generic early help, but also within the specific disability aspect as well. One of the key aspects in terms of developments is around the implementation of a more robust closure process. So there's been a significant change in this process, which has kind of promoted communication and ensuring there's a clear rationale for when we close a child's case file. And that involves, which I think is really important, agreement from the multidisciplinary team around that child, and an identification and sharing of information in terms of what would it look like if a re-referral is needed in the future, because children's needs change as they get older. Transition is a key area from around 14 plus as well, and needs might be met for that child when they're 10, for example, but at 14 you've got to start thinking around that transition to adulthood. So a re-referral at that point would most likely be proportionate and necessary. So we provide that overview at that point in terms of what would that need to look like, and how would multi-agency and also family family and sometimes a young person, depending on their needs, would be able to do that. There's been a swap audit and an implementation of an IDS funding panel, and I think that's been really key in relation to not only ensuring that we're identifying and meeting the needs of young people across Powys, but also around ensuring that we've got best value in terms of what we're offering for those young people and their families. So the IDS funding panel has been established, which takes place fortnightly, overseen by myself and also the team managers, where practitioners who have undertaken the assessment, undertaken the review of a child's needs, they come and present the information in terms of what that child's identified needs is, and we talk around the most robust and cost effective at times in terms of how do we meet that as well, ensuring that the child's at the centre of our thinking in terms of that. Previously to Scrutiny, I've jointly presented a presentation in terms of transition between children's and adult services around disabilities, and I think that's a well-established process. However, what we've recognised within the service in general is around the transition process for those children who don't hit or don't sit within the disability service, and actually what does that transition look like? That might be mental health, it might be vulnerability, etc. So kind of we've established and started those conversations around what would that look like, and we've got a process already established within children's service to adult service and disabilities, so we're using that for the time being as a stopgap whilst we undertake some review in terms of what would that need to look like in the future. So I think that's a really a key point. There's been development in terms of our disability register and our online access. The service has reviewed disability register to allow online access for families across Powys, and the aim of that is to gather kind of comprehensive information and to feed into future service planning. The website's been updated for IDS. I'm not sure whether it's live right now, but there's lots of work that's gone into that, and I've seen it, and it looks much clearer. It's really professional in its look, but also provides lots of practical support and practical kind of links for children and families to access support within the community, but also what would support look like if they were referred into the service, etc. Collaboration with our specialist schools is still in place. There's really strong established relationships between the IDS team and the specialist schools, and we continue to foster that support really, especially around those children that require transition support, and we recognise that special schools also provide the family with a short break as well, and is a real key aspect of that child's life, not only for them but also for their family as well. So that that relationship continues to be fostered. I think another development has been around the Incredible Years autism programme, and the IDS team have worked really closely with our health colleagues, especially learning disability nurses, to train practitioners within this programme, which allows us to kind of provide that early intervention and that group setting as well, for families to get that peer support as well as the professional support of the practitioner delivering that programme. Over the summer, I'm really proud of this. Our IDS service took it upon themselves to undertake and run independence workshops for some young people with complex, profound disabilities. This was positively received by children and their families. It provided a social interaction opportunity for these young people as well, but also it provided a level of short breaks, all but a short period of time, but it also met an identified need as well in terms of their independent skills. So I know that one of the activities, for example, was to make a sandwich, but that involved the list for the shopping, the kind of knife skills, the kind of putting the and also kind of eating that together afterwards in terms of the social aspects. So those kind of things are really, really important for some of our young people. I've identified some future steps that are really, really important that we're taking forward. They include reviewing our in-house residential options, addressing some of the gaps in the childcare services for children over 12. That's clearly an area in which we struggle with, and we're working with the Family Information Service and our commissioning colleagues around that in terms of how do we develop what that might look like, and develop that across Powys within the community. There's an aspect in terms of budget in terms of the impact of wage changes around the real living wage changes, and how will that impact in terms of the short breaks budget next year. And we forecasted that and we're trying to plan in relation to that a little bit. And also in terms of short breaks, lots of people think of a short break as an overnight residential care setting. A short break is a lot more than that and a lot broader in terms of it could be a direct payment for a personal assistant to take a child swimming, for example, to get lots of kind of there's lots of positives from that, but it also allows the family to have a break from their care and responsibility. So it's a huge spectrum. One of the areas in which we've identified that is potentially lacking within Powys is that short breaks foster care to enable that child to remain within a family, and that's something that we're feeding into the business case and the developments around our fostering framework to see if we can kind of develop that a little bit further, really. So there are key kind of aims over the next year. So I hope that's helpful. I'm happy to take any questions. I don't know if you want any more specifics around certain issues, but I'm happy to provide that if that's needed.
Yeah, thanks, Gavin. And Sharon, did you want to add anything?
No, thank you, Chair. I think Gavin's covered that quite comprehensively, so thank you.
That's great. Okay, right, members, I know we've got some questions on the direct payment side of things. Can I just remind members, though, that rather than this getting into a overall general discussion on direct payments, this is to do with direct payments that are going into a specific part of children's. So by all means, still ask those questions, but if we've got wider questions on the direct payments processes, that might be something that needs to be taken behind the scenes and come back to us on. Okay, so Councillor Chris.
Thank you, Chair, and thank you for that point of clarification, because my first question was on direct payments, but because I've heard different things. Some are saying it's better, some saying it's worse, but not related to children directly, so it's more broader. So I won't ask that one now. I think on page 11 of your report in 3.1, it mentions about early help teams and sharing of resources and training. Can you just unpack that a little bit more of what that looks like? That would be helpful. And then partway in the report, it mentions about some families or children's packages cannot always be delivered because of the higher dependency. My question that comes out from it is, can families challenge that process to ensure that their needs for the particular child have been considered on there? And I'll leave it at that point, because I'm going to have to disappear in a bit because of another meeting, unfortunately. So I'll stop at 2, Chair. Thank you.
Thanks, Chris. Gavin.
Yes, thank you for those questions, Councillor Chris. The first one around the early help and training and shared resources. There's been a lot of developments over the past year around, there's two aspects to early help. There's a, for want of a better term, a generic early help children's services aspect, but there's also within our IDS service, there's the early help workers and an early help team. They are part of the IDS team as a whole, and the thinking behind that in terms of the separation is around some of the specialist knowledge, I guess, around disabilities, and to have that easy access to the experts within that arena is really valuable to be within the same team, sitting under the same team manager, and they've got really readily access. It's really readily accessible to the early help workers and practitioners within that team to access a social worker that's got vast experience within disabilities, because disabilities is quite a complex area. It involves lots of health professionals, but also the terminology is really hard to get your head around, and it takes the experience of being within it to understand it, I think. So that's the rationale in terms of the separate teams. But what we've tried to do is align the thresholds in relation to kind of the interventions in which we offer, but also sharing sharing of resources. So, for example, sometimes if a child has disability, sometimes the issue or the challenge within the family isn't around specifically the disability, and it could be around some trauma, some abuse that could be happening, or actually just some real challenge in terms of financial pressures within the community. So actually to share those resources, sometimes more generic support is probably more proportionate and helpful in terms of those children, regardless whether the child's got a disability or not. So it's around kind of being really open and kind of fluid in terms of what support we need to offer, specifically for the identified need, whether that's around the disability or not. In terms of kind of the kind of certain programs that we offer, obviously the parenting program. So I've mentioned the kind of specific ASD parenting program called the Incredible Years. There's a generic Incredible Years, but there's also a more specific one focused on ASD. So the ASD Incredible Years is also offered to children and families who are open to generic early help as well, because not every child with autism, for example, will be open to the disability service, because obviously it's a spectrum in terms of needs, and neurodevelopment is kind of everyone's business. So that's the kind of the way in which the two work. They do try and work kind of quite fluidly, and there'll be lots of conversations around where is this child best, or where's this child's needs best met. If that is within the disability early help, because the disability is the main issue, or the main kind of factor within that situation, then of course we'll accept it within our part of the service. If not, it will remain within the early help generic time. In terms of can families challenge process, of course they can. I've had many conversations with children and families, well, with families in terms of kind of that whenever a child is open to the IDS service, there'll be regular reviews of that care plan under the care and support process, which is similar to any other part of the service. And parents and child's voice is extremely important within that. They feed into all assessments, and actually, if there is a challenge, then there is the process in terms of escalation. If they're not happy with the analysis from the social worker, there's a team manager, and it goes on up the system. We also look in terms of advocacy as well. That's really important within this arena, to ensure the voice of the child and also the voice of parents and carers as well is heard. So we would actively support any referrals and kind of the understanding of what an advocate provides in terms of if they weren't even if they were happy, I think it's really important, but especially if they're not content in terms of what the process has been, whether it's followed correctly, the identified need isn't quite there or right, then I think advocacy is absolutely vital within those processes as well.
And I think because they're such a marginalised group that's really important, and it builds on the reflections of the previous report that we've just had about people being listened to. So I've got that assurance from you, so thank you for that. Thank you, Chair. I'll leave now because I've got to get to this next meeting, but thank you.
Thanks, Chris. Councillor Gareth.
Yes, thank you, Chair. Just a couple of quick points, and I'm not sure the first one is for you, Gavin, or it might be even for Sandra or Sharon. On 3.22, you mentioned the pressure from the budget for direct payments. Do you know if that's gone in as a growth bid? And if it is, which part of the growth bid it's gone in, so we can just check that through. A second question relates to the special schools. I assume that's Penrice and Robert Owen. Do you also reach out into the satellite provision, such as the one at the space across gates? And then the final question I've got is, again, around direct payments. What process is in place to audit that the payments that are being made are being spent on the appropriate usage? And what flexibility is in, are the parents, the child, the young person allowed to use that in that allocation of those resources?
Okay, thank you, Councillor Gareth. In terms of the growth bid, I'm going to refer to my colleagues above in relation to that. But in terms of the second points, in terms of our relationships with special schools, you assume right in terms of Penrice and Cadawan and Robert Owen. In terms of the satellites, we are linked in with them, and actually the same head teachers oversee them. And we have a weekly triage, which involves our special schools as well as our health colleagues as well. where we would discuss any kind of upcoming children that might be moving into area, etc., or any kind of high risk situations, or unmet need, or someone else bringing in some kind of conversation about a certain individual. So we've got that really good relationship in relation to those schools. In terms of your direct payment question, I think that's a really interesting question, and it's a real challenge. And I'm sure Sharon Fruin would also have some kind of challenges within adult services around ensuring that direct payment is there and being used to meet identified need. The SWAP audit that has recently been fed back in relation kind of highlighted some gaps within our processes, which are now being plugged, and there's a review audit happening, I think, within the next couple of months internally to look at that. In terms of our processes within children's services, obviously we've got the IDS funding panel, where there's regular reviews of packages on a 6-monthly basis, but also in between that there's care and support meetings, where practitioners are advised to be really clear in terms of is the identified need still the same? How is that being used, and what does that hour by hour clock look like for that young person and support needs being implemented? So there's some real kind of robust questioning now in terms of what does that look like, and actually is it still meeting need? In terms of flexibility, there's a level of flexibility, but actually if it kind of needed to be changed and parents felt that way, there's that open communication with that social worker, with that practitioner, who can actually understand that, have that conversation, and actually agree or not, I guess. And at times that flexibility comes in crisis. We recognise that families have crisis, especially if there's disability aspects within that family, and therefore that open communication is really, really important. Quite often, if that crisis happens, we have an outsider panel decision and then feeds into the next panel, where a team manager or practitioner would contact me, and we'd have that conversation around the identified need, what needs to happen now in terms of that support for that child, because ultimately the child's at the centre of our thinking. Best value then comes kind of next to that, but we can't leave a child without the identified need being met. So I don't know if that's helpful in terms of some reassurance, but there are some processes around that are robust, and if there's some learning that comes from any situations, because there always will be, then we will look to plug those gaps as well, following and undertake a review in terms of where did that go wrong, can we actually make this system a little bit more robust.
No, that's fine, thank you.
Can I just follow up on the direct payment side of things, please, then, Gavin? On, where you provide direct payments to families, do you ever get feedback that they actually can't access, or there's no options there for what they need? I guess we're a very large rural county, and then what would happen in that instance? Would they keep the payment, or would they give it back if they couldn't spend it because they couldn't spend it on what they need? And then what do you do with that information if you're sensing there's a theme? And you mentioned about plugging the gaps. Is that what you're talking about? And are you able to give us any specific examples?
Yeah, I think it's a challenge. I think the rurality of Powys and the resources across Powys, it's spread. It is really challenging. In terms of direct payments, at the moment, my understanding is we don't have any children with an identified need that isn't being met by the service in which we're giving. But on occasion, it does happen. And quite often, if a package of care is agreed in terms of, for example, a child might need 3 hours a week support for various reasons. There's usually a gap then between kind of that package being supported and then an identification of a personal assistant, and that's often the challenge in terms of the identification of the personal assistant. So we've got some really skilled workers who are experienced within this part of the service in terms of where would they reach out to, where would they support parents to kind of look for that, exploring the family members for a start, and kind of the network of that family is always our first port of call. TAs, teaching assistants, are a godsend in terms of kind of becoming that PA, especially over holidays and weekend periods. And that's often somewhere where the links between us and the special schools are absolutely valuable, not only for a child to have education, but also to access PA support outside of school. So we would, if a need wasn't being met by by that process and we weren't able to find that, then we would bring that back and we would consider whether there's some another creative option. It might be going out to an agency, for example, and offering care via an agency. In terms of cost effectiveness, that's less effective, and actually you can't guarantee consistency of care, and you might have a different person. So there's pros and cons to that, but that would be our next step, really, if that need was still identified as not being met.
You've just given me another question. Sorry, Gavin, but on the TAs thing, that's a really interesting point, and I hadn't thought of the fact that TAs would be, you know, obviously they have time in the summer and they have the skill set. So my question is, obviously, I know this crosses over into education funding as well, but there's so many pressures in schools, and there are bound to be schools over the next year or so going through management of change processes where TAs may be being made redundant. Do we have in place the crossover between education and children's to make sure that if any TAs are looking to they might you know want to change their role and not be in the education sector anymore, or they may be made redundant, are they given the support to upskill themselves if they've maybe not been in a special school, and do they know that that option is there, and actually that could be a really viable alternative job for them if they're not able to carry on working in a school? I don't know if that's a question for you, Gavin, actually, but I just know that there's going to be management of change impacting TAs over the next year across the county.
I can come in on that, Gavin, if you want to, in terms of that.
Yeah.
So there is collaborative working with Education Services Chair on terms of those very points that you've made. And we have had staff move from school service into children's services. We've also had it the other way around as well. The children's services staff have gone into education services. So it is fluid, and we do have conversations in terms of that partnership space with our colleagues in education about always opening that door. And that goes right the way through from some of the things that Gavin has talked to, but right up to if somebody is interested in training to be a social worker. So we've actively encouraged staff to kind of work across the council where there's an interest. So absolutely, I totally agree with you. It is an opportunity where other staff with different skill sets can transfer those skills and come and work in a different environment. So that door is definitely open.
And are HR aware of that door?
Yes,
the ones that would be supporting schools going through management of change.
I could raise that with them, Chair, if that's helpful.
Yeah. Can I make that as a recommendation, please?
Yeah, absolutely. I can raise that with them so they've got that specific knowledge to just be aware of, isn't it, really? So I can absolutely take that forward.
Thank you.
Shall I come back on Councillor Gareth's point around the budget?
Yes, please. Yes, sorry, I forgot about that one.
Okay, no, that's fine. So, I mean, obviously, Gavin's provided a wealth of information in terms of the Integrated Disability Service as a whole. And part of those reflections over the last year has been just revisiting the Integrated Disability Service in terms of its roles, its remits, but that also has included the financial element. So Gavin was tasked with actually making some savings in terms of this current year's financial position in terms of the FRM, around savings around short break provision. And the reason for that was that he very articulately described that short breaks doesn't necessarily have to always be a residential short break. So as part of that review process, all children and families have been reviewed in the sense of what did that short break look like? What did it consist of? What was the cost of that? Was it value for money? Could it be provided in a different way? And it's actually enabled the service to kind of be more creative and more reflective. And there's a number of examples of where rather than the child actually coming out of the home in terms of going to a residential short break, actually the provision goes into the home, but the family go and have their short break elsewhere. So it's really kind of looked at the service through a multitude of different lenses, but also through value for money and what is the most cost benefit way of kind of delivering that service. So if anything, actually, Gavin's hit hit his savings target. That has actually been met in this year's FRM, and that's through the due diligence of that team just looking at absolutely everything. It hasn't created and caused any particular challenges in terms of escalations with families, because it's been much more about that co-production, working with children and families to work out actually what is the best support and to provide that need for them. So in terms of growth, there hasn't actually been growth in terms of the Integrated Disability Service budget. However, going forward, as part of Sustainable Powys, what we are looking at is we've got our residential home Banai, which is in the south, which is it's very closely connected to Ysgol Pen Maes. And that is a residential unit for children with complex needs who are open to Gavin service. But we're looking at Camless, which is the half of the building of Banai, in terms of exploring, could we utilise that in a different way? Could we extend that provision with Banai? Is there a need to deliver that service in a different way through that Sustainable Powys? And maybe that will create more opportunities in terms of other children being able to be placed closer to home, but also it will be looking at it through the not-for-profit lens in terms of Welsh Government's objectives. So there could well be a bid coming forward for growth in the future, but at the moment we're in that kind of exploratory stage of understanding what the need is. Is there a need for additional residential? Is there a need for additional residential short breaks? Or how can we maximise that space, that building, in terms of opportunities for more children?
Great, thank you. Have anyone else got any questions? See any other hands up? Okay, I think that's it then. Thank you so much, Gavin. It sounds all very positive. So I don't know whether we'll put this on our work programme again. I think it will be just in terms of what you just said about the cost efficiencies, Sharon. Is there anything likely to be in this next year's budget to do with IDS on this?
No, I mean, from the review that we've done this year, there won't be any sufficiencies going forward next year.
So Gavin's off the hook for coming to our budget meetings then on it. I see you smiling. Right, brilliant. Thank you. Thanks, Gavin. Feel free to go. I'm sure you've got lots of things to do. So now we're moving on to monthly performance reports. And this is our sort of fairly newish standing agenda item where councillors will hopefully have a look through the monthly performance reports. And if there's any any questions you want to ask, you can always put them in advance to myself and the Scrutiny officers, so we can put them to Sharon in advance, or you can fire away and ask them today. I think because we're fairly new to doing this, Sharon and Sandra, and have we got Sian in? Yes, Sian's here. Welcome, Sian. I think really what I would just like to start off by asking is how you, as heads of service and as portfolio holders, use those reports. Where do you, you've very, very busy people, very busy schedules. Where do you go to first in that report to go, right, I need to just quickly check whether everything's okay? What are the most important things in there for you to give you the red flags? Many councillors will be aware, perhaps not all, but we didn't used to have these back in 2017 when we had the children's inspection. We didn't get these reports at all. And one of the criticisms from CIW was that councillors and officers, senior officers could, quite legitimately say, well, I didn't know there was a problem, because they didn't have the data to measure that things weren't happening within statutory timescales, for example. So over to you, but that's a bit of context from me. And we would like to not have this as a large agenda item, but just sitting there in case there is anything we want to ask. But shall we stick with children's first, as Sharon Powell, you're on my screen, and Sandra, I don't know who wants to go first, but I'll just hand over to you guys on children's.
Okay, shall I go first, Councillor Sandra, and then you can kind of add in what you do? I think that's a really good question, Chair, because the enormity of the report is huge, isn't it, in terms of the information and the data. So where do I go first? So what I do is I kind of align it to our integrated business plan. So we have 3 key areas for our IBP, which is right help, right time, closer to home, and staff well-being. So with Right Help, Right Time, I will sense check assessments. So our assessments in timescale, and what is the percentage, and what is the comparison to the previous months of assessments being completed in timescale. This one area is quite fluid, so you will see month on month that it goes up, but then it comes down. And so for me, I'm always curious as what is that about? Why is it going up, then it's going down? Why haven't we got that consistency of completing those assessments in timescale? So for November, we've taken a dip again. So again, I'm curious as to why is that dipped? What's that about? Is it about a specific team? Is it about a specific practitioner? Is it about a resource issue? Is it about capacity? Is it about demand coming through the front door? So that's I would suggest you look at that. That is one thing that CIW focus on. So when they have conversations with me on a quarterly basis, they get the monthly reports, and they are really keen on those assessments in timescale. And that what's important about that is if an assessment is out of timescale, you need to understand why. So is it that child hasn't been seen, there hasn't been any intervention provided, and what's that about? So that's where my curiosity always lies. Most of the time, it's not about not seeing families. It is about seeing families, but it's about writing it up, recording it, and getting it signed off by the team manager within the allocated days of that assessment. So we also track how many days does it go over, and what is the reason for it going over. So if there was an assessment when absolutely nothing had been undertaken for whatever reason, I'd be really concerned about that. That would be an instant red flag. So within the data, you can also see how far over timescale those assessments go, which is always my go-to first place. And that fits exactly into Right Help, Right Time. The other thing is the demand coming through the front door. So I will look at how many contacts came in through the front door. Is that percentage going up, or is that percentage staying the same, or is it coming down? What we've seen this year is the trajectory of information coming through the front door is going up and up and up and up. That is a red flag for me, because if that continues, that translates into more assessments coming into the service, but also it's then a concern and a red flag about the capacity at the front door to be able to deal with those matters.
Can I just ask a quick question on that? Just because that was my one main question really is on the front door capacity. And I did a lambing visit with front door recently, and their main issue is if there's anything that rocks the workforce, so if someone's off sick, or if, say, for example, grant funding doesn't continue, because I think a couple of their positions are grant funded, then they can get backlogs very, very quickly. So what are you doing to monitor that, to make sure that they've got the capacity there for next year's budget?
Very good question, Chair. In terms of that, I think that is one of our pressure points, is the front door. So with the current budget position, there isn't much opportunity for growth in the current budget. And one of our big challenges is the capacity at the front door. As you said, that some of the posts within there sit within a grant funded position, which we've had to rely on over the last 2-3 years in order to create that stability at the front door. It's good in one way, in the sense we get the grant money, but it is not good in the sense of creating that stability in terms of that service right at the front door. This year, we've undertaken a piece of research because we had a graduate that came and worked with us for a few months. And I don't know if that's helpful, but maybe you might want to have some of the learning and report from that to come through to Scrutiny at some point in the new year, if that's helpful. But certainly it is a pressure point for us. And right now, there is not a solution in terms of the budgetary element to it. We're hoping that the Social Services and Sustainability Grant, so it's called Grant SSSG, it's called, will continue. Welsh Government are indicating that grant will continue. But again, we don't want to be in a position, and Sharon Fruin is going to be in exactly the same place really as me, in heavily reliance on that grant, because that could actually go at any point. And then we're really going to struggle with capacity and the demand in the front door. So it is something I'm acutely aware of, and we're looking at what can we do differently now based on the research that we've just undertaken. That might be something you want to look at a bit.
Yeah, I think what I'll do is, Carrie Ann and Kath, can we put a recommendation to raise this in our budget meeting early next year, so that we can ask the question again about the whether you've got any more information on the future of the grants, because I don't want to get too deep into this specific area, and I know we've still got to ask Sandra to answer my question as well. So I'll let you continue quickly.
Okay, so I'll just summarize. So if there was a top 3 things of looking in the performance report, I would be going assessments. I look at the child protection register to see if that's going up or down or staying the same. And I also correlate that with the regional picture and the national picture, so that we can benchmark what we're doing and how well we're doing. And then I will look at our children looked after numbers and the cost of placements. So those 3 things line with the IBP, but also those are my 3 go-to places. So it'll always be assessments, child protection register, and children looked after numbers and the cost of placements per month.
Okay, great, thank you. So that's fairly operational then. So Sandra, from your more political stance, how do you use the monthly report?
Thank you. What I look for are the red marks, obviously, first, and identify if there is anything that has changed. And usually that comes through on the amber lights, because we've got the traffic light system. And obviously I ask questions on anything that is amber, and keep a close look on which way that is moving and progressing. And usually you can see which way things are moving, and there are clear guidelines as to why. I have weekly meetings with Sharon, and if there is anything at all that is of any concern, Sharon definitely highlights and brings that to me. I've also passed my personal app to Sharon and to Nina, and it's my choice to do that. And I've told both members of staff, if there's anything that I need to know, please use that. And they don't use it regularly, but I do get some messages, and I appreciate that. And that's my personal choice. So that's me keeping in touch with what is going on. But as far as concerns are, my concern is with grants, obviously, and the dependency upon grants and the instability that grants provide. We cannot guarantee, as been said, that we do have grants, and I have been raising this in WLGA meetings with my colleagues, with the other 21 members who are also got children's services as their portfolio. And I've said that usually the grant money comes towards the end of the year, as is the norm. And then we are fed through some of the grants or slippage money that comes through. And it's very difficult on occasion to put that into practice, into what we actually need. So our staff work over and above to try to utilise that grant to the max, not let anything go back. But it might not be the actual real need for our grant. And had that come through earlier, we would have been able to utilise it much more effectively and efficiently. So I've been asking for more stability with the grants and more security as to how we receive the grants, because there's so much of our service that our staff are very proactive in looking for any slippage money, any grants that come their way, and trying to manage and rearrange whatever they are providing to make sure that they are utilising the grant as is stipulated in the guidelines, but putting it into the best effect for our youngsters. So that is a real challenge, and I'd like to applaud our staff for the management that they have done and have utilised our grants that are coming through. We have no hold on what costs can be charged for placements. That is a real concern, a real issue. We are trying our best and our utmost to bring people back, bring our youngsters back into Powys, or to keep our youngsters in Powys. That's a huge challenge nationally. Talks are ongoing. We are lobbying ministers and asking for support in these areas. And these are very grave concerns about the finance and the future of our services. So
Thank you.
Thank you.
Thanks, Councillor Sandra. Gareth, did you want to ask a question on the children's side of the reports?
Yeah, just to follow up on the points that Sharon made. You say that you've got a few key areas you look at, Sharon, do you have that just on a separate single report so you get all those information? And if you don't, because I see you shaking hands, if you don't, is it possible to do it? Because you know, I'm a data person, but I
Yeah.
don't like being swamped with too much data. I just like to see the key data and then I can dive down after.
Yeah, I don't have a separate report, but I guess I know the report so well inside out. I know exactly where to go to get what I need to. So you'll see that at the front, we have our top 5 key performance indicators. So I always look at those first, and then I go to the front door section, check on the contacts, the child protection section, check on that, the placement section, check on the cost of those. Yet the data people that work with us could easily lift that into a table if I want to, but I don't choose to do that because I like to go to the key areas, and then I like to drill down in terms of what are the data sits behind that. Staff well-being is really important as well. So, you know, we were in a place where we were having to monitor agencies, social workers, the cost of those, and that's less of a problem for me now, but I always look at sickness rates, the well-being of staff as well as part of that overall picture, which is why supervision is really important at the front. So yeah, go to the top 5 key performance indicators, check that, and then go to the key areas and then use the other data to drill down underneath.
Okay. Thank you.
Can I just ask a quick question on the section 38A, which is the residential placement costs per week? There's obviously, it's got the highest one there being for September being £12,645. Do you know, is that the same placement that was 9,938 that's increased, or are they different ones?
There'll be different ones, Chair. And I think for the cost of placements, that's a really important graph to look at and to notice, because what we're seeing is that providers are now on an upward trajectory of those costs. So it is increasing month on month. So it is an area that, so it won't necessarily be the same placement. So if we were looking for a new placement, which we have been this week, some of those costs per week now are upwards of £15,000 a week. Whereas maybe 6 months ago, they might be sitting at 8,000 or 9,000. And over the last 12 months, it's just going up and up and up. So it is something that I absolutely look at and scrutinise, but they are often different children.
Okay, thank you. Right, over to adults then. Sharon and Sian, I don't know who wants to go first.
Do you want me to go first, Councillor Sian?
Yeah,
I don't mind at all. I don't mind at all.
I don't mind whichever, but same question really. How do you use the reports?
Thank you, Chair. We're currently reviewing our report at the moment to bring it in line with our IBP and to try and make our measures more meaningful. I think you provided some really useful context, Chair, as in these reports have come from a period of time, a long time ago, 2016-17, and there is a need in adult services certainly to review how we use them and bring them up to kind of reflect our current pressures and concerns and areas of business. From adults' perspective, we use them very similarly. We don't have the level of assessment detail in our report, which is something that we're looking to build in, but it is around contacts and demand. So we use them to monitor demand at the front door, our ability to respond, as in our waiting lists, and the way that we respond and how we're providing information and assistance. There's also a priority around community capacity and our ability to respond to need. So the number of people awaiting domiciliary care packages, the amount of direct payments that we're providing, the amount of hours of support we're providing. I also concentrate on our hospital flow. So looking at how many people are actually being able to return home from hospital. And understanding where our blockages are and how that directly correlates with the capacity. The one thing I would like to mention is we have several dashboards that sit behind this performance report as well. So at any one time, I've got several dashboards around care home capacity, for instance, allocations, workflow in the teams. So we'll use those to drill down into any areas of concern to get that more granular detail. I suppose reflecting on Councillor Gareth's point around there's a lot of information in this report, but it comes from even more information, and sometimes you actually need to drill down into it to make it a bit more manageable. And then secondly, it's about the way that we're currently using the report to look at reviews and our response to reviews, and we need to flip that to include assessments as well. So that's a priority area for us. We'll use these reports, we monitor them, some aspects of them almost on a daily basis through our hospital flow meetings. We'll look at our system performance twice weekly, and then monthly we'll take a deeper, more generic kind of helicopter view around them through our SMT. And then I'll meet with Councillor Sian regularly to go through any aspects of it that need addressing, and we try to meet prior to our performance meeting to go through them. We don't often succeed, and we don't often get the time we need to drill down into it either, which is an area of concern because of the level of detail. We do have issues around the way that we capture data sometimes and the way that we input data, so we're constantly trying to refine that to get that as accurate as possible. And there's something additionally that we need to add into our performance around, I think, which is really useful, that Children's Services do, is around those cost of placements, because that actually gives us some really good intelligence that we have, but we don't have it in this format. That's a real whistle stop tour, because I know we're strapped for time, aren't we?
Yeah. Councillor Sian, what about yourself?
Thank you, Councillor Amanda. Yes, so they're really important for me, the monthly reports. I use the Power BI dashboard to examine them, and as Sharon said, we schedule the meetings monthly, but we don't always manage to make them because of other demands on our time. But it's something we want to resolve in the coming year, because it is really important. So we meet regularly one-to-one for our general meetings, and I quite often raise issues around the monthly report and questions I have, diving deeper into particular areas. But there isn't really, after you asked that question, I had a look again at the monthly report to see if there are things. I tend to look at all of it, you know, the things that really stand out for me and the ones that I'm really interested in. I'll read all the bar charts and the measures on the left-hand side first, and then I'll read the narrative, and I'll have a little think about whether there's anything missing from that narrative. And as Sharon has just said, all of that information exists behind the scene, but I might need to talk to her to find out for it myself. But the things that stand out, a really important section for me is the front door, because of course the front door as well is related to prevention and keeping people supported and well and independent in the community by providing the advice and information and assistance that they need at the right time. So I look at all of those measures quite carefully. They're all important to me, especially the referrals to community connectors and the prescriptions of technology enabled care. Those are the ones that kind of stand out, that are particularly of particular importance to me. The hospital pages, of course, because timely flow from hospitals is such an important issue for us, and such a focus of so many of our workers' attention. It's such a key area for us, and particularly the discharge to recover and assess pathways, and whether that's in their own home or in a community placement, a care home interim placement. So I just keep an eye on that, whether the figures are going up and down or not. And as I said, Sharon and I will pick up on it in our meetings. Long-term care, I'm keeping an eye on always the average age of admissions into residential care and the numbers of people in residential care and the new admissions into residential care, of course, because we're focusing on prevention and early help and support in the community. We want to make sure that the age of admissions isn't going down. People aren't averaging at younger ages going into residential care, and we've been holding that stable for a couple of years despite the increased demand. So we're grappling with a much higher demand, and yet we're managing to keep that pretty stable, the age going into residential care, and also the numbers as well. So I keep quite a close eye on that, and Sharon and I talk about that. It would be quite good, I think, in the monthly report to have some context around those figures. So, for example, how many people are waiting? I'd quite like to see our waiting figures somewhere in the report as well, and Sharon and I are going to discuss that when we come together to explore the changes that are being made. And also people with learning disabilities and supported living, whether they're in county or out of county. Clearly, we've been talking about placement costs already. That's something for us really to keep an eye on. We want to bring as many people in county as possible for their supported living. It's a major work stream, as you know, and has been for several years, and I keep an eye on that. And then the completion of reviews as well. We need to make sure people are getting the right care, and that the packages are being right-sized and their care is being right-sized regularly. Workforce is important to me. I keep a close eye on the reasons people leave, staff well-being in these very, very pressured times where we haven't got enough money really to do all of the things that we want to do. And we want to keep the number of agency social workers down, and we know that people are under a huge amount of pressure in their work a lot of the time. So staff well-being is of primary importance, and I do like to keep an eye on the reasons that people leave. And the compliance against the quality assurance policy as well is something that I raise regularly with Sharon. I want to make sure that we're looking at qualitative measures as well as the quantitative ones, and we know that a lot of our measures are quantitative, and I want that to be balanced out with looking at what people are saying in terms of its impact on them, and those kind of soft targets type thing. And of course, as Sharon has already mentioned, Sharon Powell mentioned this, supervision is really, really key to keeping an eye on staff well-being. That's where staff are going to be able to explore how they're coping in their job, what the stress levels are like, what their well-being's like, whether we're catering for that well enough, and to flag up for us if there's more that we can do. So those are the really important things. And as Sandra said, you know, the financing of services, these are discussions that we have in our cabinet members networks and the national meetings that I go to, as you can imagine. The huge pressure of the uplifts that providers need to be able to provide care because of the cost of providing services is going up for them as well. And the fact that demographic bell curve is going to remain on the steep slope for several years yet. You know, we're not really cresting the wave of that for another 15, cresting the curve of that for another 15 years. And yet the public sector financing is becoming more and more constrained. So obviously these are key issues that we're raising with Welsh Government ministers. And the other one that I've started to raise is, apart from obviously we need adequate funding of social care, is we also need maybe some focused prevention funding. So we, especially for hospital, we want to be able to prevent people from needing to be admitted to hospital in the first place. So that's a key area for us at the moment.
Thank you. I think we're going to have to move on fairly quickly. But Sharon, did you want to come back on something Sian said quickly?
It was only to say I was Sian's covered it actually, Chair, and it was around the need to improve on the qualitative data, because actually the richness of information that we get is usually through the discussion around qualitative data rather than the numbers. So we're looking to actually refine the report to include more of that.
Great, thank you. I can't see any other hands up, and I'm just conscious of time, but thank you for that. I think going forward then we will just keep it on our agenda, and then if there's no questions that members have, we might not, you know, go into detail during the actual meeting, but we want to keep it on. What I'm going to do is I'm going to skip over the next item and move that to the end, just because I'm conscious that we need to get on to our last item, which is the unaccompanied asylum seeking children who are looked after by the council. This is down to be going in us going into confidential session. However, we've had a brief discussion beforehand, and I think what we're going to do is start it off in the public session, and then if there's any discussion going into costs of specific placements, then we will put that into a private session. So we're not going to discuss anything to do with where people are specifically located or the costs of any individual placements. But what I'm going to do now is I'll hand over to Jo Harris and Sharon Powell and Councillor Sandra to introduce this and provide a bit of the background. But we don't need to see the report on the screen, obviously, because that needs to be split up. And then as soon as we get on to questioning, I think that's when we'll go into confidential session. Thank you all.
Diolch yn fawr, Cadeirydd. Thank you, Chair. I'll just, if I may, outline the purpose of the report, and then I'll hand it over to Joanna, who is here with us, and she can present the rest of the report in more detail. The unaccompanied asylum-seeking children, UASC children, represent one of the most vulnerable groups arriving in the United Kingdom. These children, who arrive without any parents or guardians, face numerous challenges as they seek safety and security. The County of Powys has been actively involved in addressing the needs of UAS children, implementing various programmes and policies to ensure their well-being. The report provides a comprehensive review of the recent developments in Powys concerning UAS children, and the report provides an update to a Health and Social Care Scrutiny Committee on the numbers of unaccompanied asylum-seeking children in Powys, how children's services have been able to meet their needs, and the costs associated with this area of work. Now, if I may, hand over to Joanna Harris, who is our Senior Strategic Commissioning Manager of Children's Services. Thank you, Chair. Thank you, Jo.
Thank you, Sandra. Welcome to Scrutiny, Jo.
Thank you, Chair. Thank you, Councillor Sandra. Shall I just give an update? So the purpose of the report, well, the report aims to update Health and Social Care Scrutiny Committee on the numbers of unaccompanied asylum-seeking children in Powys and how Children's Services have been able to meet their needs and the associated costs. So the handling of unaccompanied asylum-seeking in Powys, children in Powys, is governed by a robust policy framework that complies with national and international laws. That includes the Children's Act of 1989 and 2004, the Immigration Act, and the Social Services and Wellbeing Act. So the National Transfer Scheme, NTS, is a mandatory scheme, and it supports local authorities across the UK by providing specific payment arrangements. Powys has received 33 unaccompanied asylum-seeking children referrals over the last 18 months. 17 of those children have been placed within the 5 days, which earned the local authority additional one-off funding. The one-off funding had reached £15,000 per child for a specific period in time. However, that has now ceased and returned back to the £5,000 that it originally was. Our current cohort, or the cohort as at the 31st of October, Powys was responsible for 17 under 18-year-olds and 13 over 18-year-olds. These individuals are placed both within and outside of Wales, and our current strategy is to place in county, as opposed to our original strategy when we first joined the NTS scheme, where we were placing outside in more urban areas, as we felt the children could be best supported in those more urban city locations. However, we've now changed our strategy. Our strategy is to place directly in Powys. We now have a workforce which has been upskilled. We have a better understanding about how we can support young people in our local communities. We also find it very tricky once we placed a young person outside of Powys or outside of Wales. It was very difficult then to move them into Powys, which is such a rural location. So our strategy at the moment is to place within Powys, and that also aligns with, it also reduces travel time for social workers because they are looked after children and they require those statutory visits. So it reduces that travel time, but it also aligns with the Welsh Government Eliminate Profit from Care agenda, ensuring that children are placed within county. It's important to note that we've had 3 referrals during November, in addition to the ones I've already mentioned. So Powys Children's Services has been working really hard to develop a suite of properties and to provide placements in Powys for children who are looked after and are care leavers. And these properties help then support the transition from 16+ accommodation into independent living. We've also been working with our external providers so that they can develop external placements within county. So we've got a lot of external providers who are providing specific unaccompanied asylum-seeking placements, but often they're outside of Powys or outside of Wales. So we're working with those providers who are keen to move into Powys to be able to provide those placements within county. We also lead the regional group across Mid and West Wales, so that we can establish a more coordinated approach to how we manage our response to the referrals for unaccompanied asylum-seeking children. So we take a lead on this work, and currently we're in the process of developing our strategy and a regional welcome pack for children who are being placed within the Mid and West Wales region. We also share training opportunities. The Home Office provide a range of training opportunities to local authorities, and we encourage members of our workforce to attend those, often online, to upskill, because it is a very specialised area. We work with our education colleagues to ensure that we're providing comprehensive education and integration programmes for children, which includes our language support. And we're also working with our volunteer organisations and not-for-profit groups across Powys, because there are a number of those that also support unaccompanied asylum-seeking children. I've detailed the challenges within the report, and that predominantly is our resource constraints, the legal complexities around the process around securing, the right to remain, and some of the cultural barriers that we sort of grapple with as we support those children effectively as possible. So that's kind of an overview of the report. I'm happy to take any questions.
Thanks, Jo. Yeah, and I just remind members, any questions on the specifics of placements or localities of placements, we'll park those to the end. I've just got a quick question, Jo. Obviously, you have provided us with some information which shows how much you get per week per child, and also the costs of placements per child. Are you able to provide us with the information showing the overall shortfall that you have in terms of, you get X amount from the government, and yet it costs you X amount, which is over and above that. Could we have that figure going forward?
Absolutely.
Or do you have it? Do you know it?
I don't know it to hand. Our finance colleagues have prepared the financial element of the report, but we keep a spreadsheet between ourselves and finance where we monitor every child, and as that child moves placement, their placement costs might change, and then that spreadsheet calculates then whether the income associated with that particular child covers that cost, and if it doesn't, what's the shortfall. So there is a mechanism by which we capture that. I haven't got it at my fingertips.
Are there any channels of communication in place where you can go back to the Home Office and say, look, this is the actual cost, and I guess that's possibly more of at a political level as well, but surely are they aware that there is a shortfall?
Absolutely, and we have discussed this in our Sharon can come in actually, because we've done some very recent work on this. Sharon?
Yeah, thank you, Jo. Thank you, Chair. I think it's a really good question, Chair, and actually the answer to it is no. So there is no kind of flexibility in those arrangements. So you get allocated your child, you get allocated that cost per child, but if the cost of that child increases, which we have faced in terms of some of our young people, then there is no additional funding that actually comes with that cost of that placement. This has been challenged by us as a local council, but also as a region. We've actually, Pembrokeshire took a lead in terms of writing from their chief exec to UK government on this very factor, and actually in Powys we've done the same. So we've recently submitted that letter to UK government about that. But prior to that, I have been raising this at a national level with the All Wales Heads of Children's Services, through to ADSS Cymru, through to the WLGA, into Welsh Government, in terms of raising those complicating factors. There isn't any solution or answer in terms of bridging that gap right now. So it becomes an immediate pressure for us in terms of children's services when we have a young person with additional complicating needs, whatever they might be, and the cost is over and above what the cost we get from UK government.
Letter, and also can you let us know when you get a response?
Yeah, of course.
That would be great, thanks. Could we make a note of that, please? Carry on. Councillor Gareth, you had your hand up, but it's gone back down.
Yeah, I don't know where it's gone back down. Section 4, under resource implication, gives a list of individual children. Are they the only unaccompanied asylum-seeking children we've got in the authority at the moment, or are these rated the ones additional ones we've received in the last 18 months?
So these would be the children that we had within the local authority as at the 31st of October. And as I said earlier, there have been 3 further referrals since then. But yeah, these are the current.
Right. I've got other questions, Chair, but I'll bring that up in the confidential
Yeah, I
session.
think we're possibly at the stage of wanting to go on to the confidential session. Members, have you got any more general questions on this? No, okay, right. Carrie Ann, are we able to go into confidential session, please, so we can discuss some more? Oh, actually, do we need to vote it?
Yes, please, Chair.
Yeah.
Yeah, okay. So, Joe, I guess we just need an overview from you on if we're going to ask questions on specific placements. You know, why that's confidential.
Okay,
I
I
know
think
it's obvious.
yeah, I think that it is just a very, very small cohort of young people who are looked after, very vulnerable young people. And due to the small sort of numbers, I think if we're going to talk about specifics around placements and locations and costs, I think that could be identifiable. So I think it would be better to discuss that in a confidential session.
Yeah. Any members, if everyone agrees, just see a show of hands.
Can we have a proposer and a seconder to take into confidential, please, Chair?
Okay, can someone propose, please?
Happy to propose.
And someone second, please. Yeah, Councillor Little seconded. Thank you.
Okay, I'll move us into confidential now.
Thank you. And thanks, Councillor Shan, for joining today, and to your work experience people. I hope they've enjoyed listening in.